Hey everyone, and welcome back to the channel. Today, we're re-tackling a question that probably pops into your head every time you start sniffling or feeling that tickle in your throat. Is this just a cold, or is it something more serious? It's a common worry, and telling the difference can be tricky. So, in this video, we're going to break it down, look at the key signs, and help you figure out when it's time to just rest and when you should probably see a doctor. Let's get right into it. First, let's talk about the classic common cold. We've all had it. The main culprits are rhinoviruses, and they are experts at making us feel miserable for a few days. The symptoms usually come on gradually. You might feel a little tired one day, then wake up the next with a scratchy throat. Then comes the sneezing, the runny or stuffy nose, and maybe a mild cough. The key word here is mild. With a cold, your symptoms are typically concentrated in your head and throat. You might have a slight headache or some minor body aches, but you can usually still go about your day, even if you're feeling a bit sluggish. A fever is pretty uncommon in adults with a cold, but if you do get one, it's usually low grade. For most people, a cold runs its course in about 7 to 10 days. You start feeling a little better each day after the peak, which is usually around day 3 or 4. So, to recap for the common cold, symptoms are gradual, mostly above the neck, and you generally feel okay enough to function. Now, let's contrast that with the flu or influenza. The flu hits you like a truck. Unlike a cold that creeps up on you, flu symptoms often come on suddenly and with a vengeance. One minute you feel fine, and the next you feel like you've been run over. A high fever, usually over 100 degrees Fahrenheit or 38 degrees Celsius, is a hallmark of the flu. You'll also likely experience intense body aches, chills, and a headache that feels much worse than a typical cold headache. And the fatigue, it's on another level. With the flu, you're often so exhausted and weak that just getting out of bed feels like a monumental task. While you might have some cold-like symptoms such as a stuffy nose or sore throat, the systemic symptoms, the fever, aches, and severe fatigue are what really set the flu apart. A flu-related cough is also typically more severe and can be dry and persistent. The flu can last 1 to 2 weeks, but the severe fatigue can linger for even longer. Because the flu can lead to serious complications like pneumonia, especially in young children, older adults, and people with chronic health conditions, it's important to take it seriously. If you suspect you have the flu, it's a good idea to call your doctor. Okay, let's move on to another common concern. Sinus infections, or sinusitis. A sinus infection can sometimes feel like a cold that just won't go away. In fact, it often starts as one. But, while a cold usually starts getting better after a week, a sinus infection can stick around or even get worse. The key differentiator is facial pain and pressure. If you feel a persistent, throbbing pain around your eyes, across your cheeks, or in your forehead, that's a big red flag for sinusitis. This pain often gets worse when you bend forward. Another telltale sign is thick, discolored nasal discharge, yellow or green. You might also have a stuffy nose that makes it hard to breathe, a reduced sense of smell and taste, and maybe even a toothache. Since the pressure from your sinuses can affect the nerves in your upper teeth. While a common cold is a virus, sinus infections can be viral or bacterial. If your symptoms last for more than 10 days without improving, or if you start to feel better and then suddenly get worse, it might be a bacterial infection that requires antibiotics. So, if that facial pressure and thick discharge are your main complaints, and they're not going away, it's time to check in with a healthcare provider. Now, let's talk about a sore throat. Is it just from a cold, or could it be strep throat? A sore throat is a common symptom of many viral infections, including the cold. But strep throat is different because it's caused by bacteria, specifically Streptococcus bacteria. A strep throat comes on very quickly and is characterized by severe throat pain that can make it difficult to swallow. When you look in the mirror, you might see a very red throat, sometimes with white patches or streaks of pus on your tonsils. You may also have tiny red spots on the roof of your mouth. Another clue is what you don't have. With strep throat, you usually won't have a cough or a runny nose. The symptoms are focused on that intense sore throat, often accompanied by a fever, headache, and swollen lymph nodes in your neck. Since strep is bacterial, it needs to be treated with antibiotics to prevent more serious complications, like rheumatic fever. The only way to know for sure if you have strep is with a rapid strep test or a throat culture at your doctor's office. So, if you have a sudden, severe sore throat without the typical cold symptoms, get it checked out. Next up is pneumonia. This is a serious lung infection where the air sacs in your lungs become inflamed and can fill with fluid. Pneumonia can be a complication of the flu or even a severe cold, but it can also develop on its own. The cough associated with pneumonia is often very different from a cold or flu cough. It's typically a deep, productive cough that brings up mucus that might be greenish, yellow, or even bloody. A major warning sign for pneumonia is shortness of breath or difficulty breathing. You might feel like you can't get enough air, especially when you're moving around. Chest pain that gets worse when you breathe deeply or cough is another common symptom. Like the flu, pneumonia usually comes with a high fever, chills, and severe fatigue. You might also experience confusion, especially in older adults. If you have a persistent, mucus-producing cough combined with fever, chest pain, and shortness of breath, this is a medical situation that requires immediate attention. Don't wait. See a doctor or go to an urgent care clinic. Let's also touch on bronchitis. Bronchitis is inflammation of the lining of your bronchial tubes, which carry air to and from your lungs. Acute bronchitis often develops from a cold or other respiratory infection. The hallmark symptom of bronchitis is a persistent cough. At first, it might be a dry, hacking cough, but after a few days, it can start to produce clear, white, yellow, or greenish mucus. You might also feel some soreness or tightness in your chest, experience shortness of breath, and hear a wheezing or whistling sound when you breathe. A low-grade fever and fatigue are also common. The main difference between bronchitis and pneumonia is that bronchitis is in the airways, while pneumonia is deeper in the lung tissue itself. Most cases of acute bronchitis are viral, so they just need to run their course. But a cough that lasts for more than 3 weeks, produces blood, or is accompanied by a high fever or severe shortness of breath warrants a doctor's visit to rule out something more serious like pneumonia. Finally, a quick word on allergies. Sometimes, what seems like a never-ending cold is actually seasonal allergies. If your symptoms include sneezing, a runny nose with clear, watery mucus, and itchy, watery eyes, and these symptoms flare up at certain times of the year or in certain environments, you might be dealing with allergies. The biggest clue is the itchy nose, itchy eyes, itchy throat. You don't get that with a cold. Also, allergies don't cause fever or body aches. They can last for weeks or months, as long as you're exposed to the allergen. If your cold seems to follow a seasonal pattern and is heavy on the itching and sneezing, consider talking to your doctor about allergy testing. So, let's quickly summarize the key things to watch out for. Think about the onset. Was it gradual like a cold, or sudden like the flu? Consider the location of your symptoms. Are they mostly in your head, Or do you have severe body aches and fatigue? Pay attention to your fever. Is it low grade or non-existent, or is it high? And notice the duration. Are you getting better after a week, or are your symptoms lingering or getting worse? Signs that you should definitely see a doctor include a fever over 102 degrees Fahrenheit or 39 degrees Celsius, symptoms that last more than 10 days, trouble breathing or shortness of breath, chest pain, a severe headache, or a rash. Also, if you start to feel better and then suddenly take a turn for the worse, that's a signal to get professional medical advice. Ultimately, you know your body best. This information is meant to be a helpful guide, not a substitute for professional medical diagnosis. When in doubt, it is always safest to consult with a doctor or a qualified healthcare provider. They can give you an accurate diagnosis and ensure you get the right treatment. Taking care of yourself means knowing when to rest and when to seek help. Thank you so much for watching today. I hope this helps you feel more confident in figuring out what is going on the next time you feel under the weather. If you found this video helpful, please give it a thumbs up and consider subscribing to the channel for more content like this. Stay safe, stay healthy, and we'll see you in the next video.